Hello dear patients. Today we are going to review the case of stripes and cracks on the nails during psoriasis. A woman came to see us. She had psoriasis for quite a long time, and at the present time it was in remission, so there were almost no rashes at all. However, on the nails, particularly on the thumb, in the area of hand, there was quite a big stripe, as you can see. This stripe was deepening into the depth of nail, and there was a slight swelling of nail wall preceding that stripe. Also, there were irregularities on some other nails, as you can see on the picture. What it is? Indeed, during psoriasis, a so-called pitting symptom is described. This is when there is a deepening on the nail, which looks as if it is located on the thimble. But in this particular case, we don't see that. We see quite big deepenings that look like a big stripe. We also see the disorder of other nail structure. What it is? It is a psoriatic lesion, the lesion of nail matrix by psoriatic process. The matrix is where the nail grows from. Indeed, this is quite often seen during psoriasis. What is recommended to do in such cases? First of all, fungi need to be diagnosed, as often the psoriasis may be accompanied by fungi, particularly if it's the hand nails. Then, these are the fungi of Candida family. Therefore, first of all, it is necessary to take scraping from the inflamed nail wall for PCR of 8 Candida, culture test for Candida, as well as to take the scraping of nail base for microscopic fungi, and preferably to take culture tests for fungi as well. This was done in this case. However, no fungi were found out. This is crucially important because this affects what we are going to do, to either use antifungal medications or to treat psoriasis of nails more actively. What is used for treatment of nail psoriasis and what did we do in particular? First of all, a common therapy of psoriasis is recommended. That is sodium sulfate intravenously, calcium gluconate intramuscularly, ozone, vitamin therapy, that's first. Second, externally, strong glucocorticosteroids can be applied on the nail wall by type of clobetasol. It is not necessary to do it using a patch, it is even undesired. It is just done by rubbing without occlusion. If we found Candida, then it would be important to use anti-Candida medications because often Candida induces an aggravation of such process. What was also additionally done in this woman? These were injections of triamcinolone directly into nail wall using a special bandage to compress the nail base. To be more specific, to compress the base of finger. This method is quite actively used. The dosages of hormone are quite small as it is administered only directly into the area of nail matrix. This reduces the inflammation and removes such nails. Of course, here we'll have to wait for the growth of a healthy nail after these administrations. How often such administrations are prescribed? For this particular woman, 3 administrations were done with an interval of 2 weeks. Generally speaking, that's not a lot. Then a healthy nail started to grow, at least on the most bothering area, on the thumb. Also, analogues of D3 vitamin are used in the form of ointment. Photochemotherapy or buvo-therapy may also be used, particularly the local apparatuses for arms and legs. Also, retinoids and more strong therapy can be used. Recently abroad, the preparations of biological therapy are quite often used successfully. However, for Russia it is quite expensive to use preparations which cost 50 to 70,000 rubles a month during nail lesions, which is quite uncomfortable for our patients. Therefore, during such psoriasis, the most effective is external therapy, sodium sulfate and calcium gluconate in the form of injections and direct administration of glucocorticosteroids into nail base. If it is necessary to diagnose and treat different problems in the area of skin, nails and hairs, you can consult our dermatologists of paid medical center of Dermatovenerologic dispensary in Moscow.